How Adora, sorry, it's Adora. How are these measles and rubella transmitted? What's the transmission mode?
Okay, so like he mentioned earlier, when you can be transmitted through when a person coughs, sneezes, or even talks. So it can be airborne, and then for measles is usually contagious 4 days before the rash shows and 4 days after. Okay, so that's why it's easy when a child in school has measles. Before you know, every child there will come down with the measles.
Because it has incubation period.
Yes. So as at that for 4 days, when it's still incubated, when you are not seeing the rashes, which is how we usually tell that this child has measles. You know, the child can actually transmit it to other children in the that they come, or people that they come in contact with. While rubella is usually transmitted, contagious, like 7 days after the onset of rash. Okay, that's why when a pregnant woman, plays with a child that has rubella, without knowing that, okay, this is actually maybe just see an innocent looking rash, the pregnant woman can be contact it. And when most times when they see rashes in an adult, they will just assume that this is also part of the pregnancy. Pregnancy comes with different issues. Okay, so that's why most people, when they come down with it, after they don't even bother going to the health facility to know what is wrong, which is how it now, once they contact it, it affects the fetus in the womb, the unborn child, and which is very serious, can even lead to stillbirth of the child and all those other complications like hole in the heart, deafness, blindness for the new the baby in the womb. Yes,
that's a very big one. Okay, what about the prevention? Lead us through on that.
Okay, so one of the things we are doing, which is this measles rubella vaccination, is part of the preventive measures, because it creates what we call herd immunity. It brings down the measles infection outbreak, because Nigeria alone accounts for up to 50% of measles and rubella cases in Africa. So you can see how serious it is, why the government took this very serious. So this campaign, this vaccination, is one of the ways that we can prevent this measles rubella disease. And then you can also practice good hygiene. Good hygiene, when you touch, especially after contact, you wash your hands, and then avoid close contact with people who are infected. You don't see somebody with a rash and go close. You avoid close contact with them. Since we also know it's airborne, when somebody is infected, you ought to try to protect yourself. And then ensure proper ventilation in homes and public spaces. That is very essential to curtail the outbreak. Then I've mentioned avoiding close contact with infected people. But most importantly, bring out your children 9 months to 14 years for this vaccination. It's one of the ways we can create this herd immunity and lower the outbreak or the prevalence of this measles and rubella virus in our community.
Okay, Mr. Chukwudi, where does it come from? We have this one, that monkeypox from monkey, this one malaria from mosquitoes. Where did this one stem from?
Like I said, this rubella virus is not a new virus. It has been there for decades. You understand? Like the polio virus, like the measles virus. All these are what we call vectors and pathogens that is in our community, in our environment. But most times it's been ignored, like this particular rubella virus, because the symptoms are very mild. You don't even bother you, don't worry you. So that's why even most times, if you remember, like those days we took vaccination, when we were younger, you can see that someone that that took that vaccination, after a while, you see that person, even now, you see that you're coming down with something that looks like measles. So, and you'll be wondering, this child has taken this vaccination before. Why coming down with measles? So, because the country or the Minister of Health have not taken the cognizance of this, so we started conducting the research of what might be this that is similar to measles. We now find out from the research that this is rubella. And if you go to other countries like Africa, they give 3. They give measles, mumps, and rubella in one. So, and you know that these vaccines are costly. So, and you know the country we are in. So, after much proposals and the different governments, now, remember, so no, let us put hand in this to reduce this virus within us. And moreover, this, like I said, this vaccine is not new. It has been there since 1979. It's in the market. People buy it, but it's costly. Government just came in to subsidize this to make sure that we will eradicate this particular virus for our families to be happy. Remember, just if you take a woman getting pregnant, carrying that baby for good 9 months, then giving birth to that child will come down with hole in their heart, blindness, they can't talk to the mother, they can't cry, just so many complications. How would that family, where would that happiness come from? So these are some things that happens that makes family to break, and some people sometimes will be thinking that my brother in the village have done this to my child or this one, but you will not know. So that is why after the research, we now came out to tell our people, that's why we're sensitizing, telling our people both the symptoms, what we can see. You go to the nearest health facility so that a professional will look at it and give you a proper treatment for that.
Okay, let's go to the vaccine. What is this measles rubella vaccine?
Measles rubella vaccine is the vaccine that is being developed to prevent measles and rubella virus in our environment. And again, measles and rubella vaccine is the only way to prevent this virus in our environment. We say prevention is better than cure. And you know, primary health care, they do preventive medicine, while the public health, do curative. So that is why, and after this campaign, this 9 months to 14 years, this vaccine is going to be routinized. Routinization means putting it into our normal routine immunization. But it's not going to be the children 9 months to 14 years again. It will only be children 9 months and 15 months. The same time, their baby will be taking measles first dose and measles second dose. So it's going to be now measles and rubella first dose and measles and rubella second dose. And the measles vaccine in our facilities now is going to be retrieved within this campaign period. So that what you'll be seeing now after this campaign, from 13th of February, what you'll be seeing across all the health facilities in Abia State, the 292 wards in Abia State, and all the 778 health facilities across the state will have, what you'll be seeing there is measles and rubella vaccine.
Okay, you've talked about the eligibility 9 months to 14 months for now.
14 years.
14 years, rather. And after now, it will be 9 months to 15 months. Now,
a year and 3 months.
Okay. Now, who can this vaccine be given alongside the other routine vaccines?
Yes. In fact, if I may say, yes, measles vaccine can be administered alongside with other routine childhood vaccines. It is safe. It does not interfere with its effectiveness. And moreover, if you are there, for example, now your child or your wife took your child for immunization yesterday, and yesterday there is an immunization day, which is on Wednesdays, then we started this campaign today, and that child is between 9 months and 14 years. That child is eligible. One, vaccination does not have overdose. Instead, it increases that child health immunity. It increases the health immunity of that baby. So that's why sometimes you see we do campaign of polio now. After 1 or 2 months, we'll still do another polio campaign. Or we'll still do another campaign. Telling you, because all these things are trying to bring up the health immunity of the communities. And why this 14 years we linger it is for people that were supposed to have this rubella vaccine that couldn't have it when they were between this age bracket, 9 months and 15 years. That's why the government prepared for them. And do you know why? It's because of this pregnant mother. Because if this cohort is being captured, there will be no place this pregnant mother will be contacting the disease, because this particular cohort is the active stage where this virus incubate more. So that's why government have planned for this cohort to catch them up, then bring it down to the normal routine immunization.
Okay. I see. Now back to Ms. Adora. Are the vaccines safe and efficient?
Okay, so this vaccine, the measles rubella vaccine, is completely safe. You know, the WHO, NAFDAC have certified it safe. The researches have been done before it even was released in the market. Like we said, it's not a new vaccine. It has been in existence since 1979, the measles rubella vaccine. It's just that Nigeria is conducting its campaign now. And this campaign is throughout the whole country, the whole 36 states of the Federation. So please, the vaccine is safe and it's free and it's very effective. So there's no need to worry about any issues with the vaccine. People have been taking it. It's not new. Researches have been done and certified. So it's 100% safe.
Most times when these kind of campaigns are launched, you start getting audio messages on WhatsApp. These people want to kill this particular group. Please don't allow your child to be immunized or vaccinated and all that. What are you doing to correct that narrative?
Okay, so of course, as you mentioned, there will always be rumors. People, they say, who said? Nobody said, Okay, but that's why one of the, coming on air right now to educate the masses is one of the steps towards addressing these rumors. So we're doing a lot. We're sensitizing people, paying advocacy. So we're carrying everybody along, everybody. Traditional rulers, the churches, the women affairs, we're carrying everybody along. So to explain to them that this vaccine is for the good of our children. We're not here, it's not to cause any issue, and it's not a new vaccine. So if there was any issue with the vaccine, it would have been discovered a long time ago. Like I said, it has been there since 1979. So if it was causing any issues, of course, it would have been discovered from that time till now. So the vaccine is 100% safe. So in the abia, we're here to tell you that you don't have to fear about anything. It's free, it's safe, and it's very effective. And thank God this measles and rubella virus is what we see in our communities. We see our children come down with it. So you don't need anybody to tell you that you have to protect your children from it, because we see it every time. And this is the opportunity to take this vaccine and protect your children for free. So it's safe. There's nothing to worry about.
Okay, so you are assuring Abians that the quality or standard has not been compromised. I mean, they are not produced here. And in terms of during the period of transition and all that down to everything is okay.
In fact, the cold chain we've made all the arrangements to make sure that we maintain the quality of this vaccine throughout the campaign period. Of course, the governor has been fantastic. The administration of Abia State have been fantastic. There have been freezers provided to all the LGAs. There have been things done. The preparation have been massive. A lot has been done, to prepare for this campaign. And we are assuring you that you are getting nothing but the best. The quality, you can even check, when they are vaccinating your children, you'll be sure that these vaccines are protected. The coach and the teams will have their ice packs and everything to maintain the quality of these vaccines. So you don't have to fear about anything. Everything has been prepared for, and it's safe, it's effective, and we're prepared.
Are there side effects? Okay.
We have the state has provided, because this vaccine are being transported through a certain temperature. That's what she's trying to say. So the state have planned for the production of ice packs. Ice packs is what you use and give to just these teams. Because we have about 800 and something teams across the whole states that will be moving around to vaccination. So we have planned for the production of this ice pack. That's why she mentioned about the freezer, because that was one of the because that was one of the gaps we are having in the state, how to produce these ice packs. So the governor and the state government have purchased ice life freezers for all the AGS to bridge this gap. So it's a good news to us because we have a governor that has the health of our citizens at heart. And you should understand that last year, I remember, he just retrofitted some about 200 health facilities to the primary health care to make sure that the health agencies of our state is up. And again, you know that we have what we call some side effects when you give a vaccination that we call AFI, Advanced Event Following Immunization. We are not living in this moment because we know that when a child is being vaccinated, and we are giving this vaccine, and vaccine, if you give a vaccine, introduce any vaccine into a system, the system does what we call seroconversion, converts it into being a herd immunity to that body. So during that seroconversion, that child or that person might experience some little maybe headache or fever or just a mild, because the first phase have implemented, the Nigeria have not recorded any serious AFI or any serious side effect of this vaccine. But be as it may, once any new thing is introduced into a system, that system must react to it. So that is that headache or little fever or soreness or redness in the site of that injection. But after a few days, that child will be fine. Or if you give that child paracetamol or a little cold bath, that child comes to normal. But be it as it may, if that child, if you notice any further changes in that child, you take that child back to that to the nearest health facility. The professional can look at that child and give a proper attention to that child. Okay. And in fact, today, Abia State is training clinicians on this AFI at Bishop Mwedo Pastoral Center. They are training the clinicians across the state that will be handling these AFI cases during this implementation. So you can see that everything is on ground. We are good to go, both in social mobilization. So while we came here, like we were asking her before, that is why we are here to give you the key messages that you, as the broadcaster, know you are talking about it. You know exactly what are the key messages, and when you get these rumors, you can be able to dispel them and tell them, look at the benefits of this. You know, you don't force people to give them medication, but when they know the betterment and the benefits of that medication or that vaccination, they will opt to have it themselves. They will decide that they will do it. So that is why how we combat these rumors is to give them the proper information and allow that individual to now take decision on what is good for him.
Okay, quickly, where can people get it? How do we access this vaccination? The locations?
Yes. This campaign is starting on the 4th of February to 13th of February next month. And like I said before, we are going to be applying two strategies. Fixed posts that our trained health workers, the team members, will be staying at the health facility where our caregivers and mothers will be bringing their eligible children 9 months to 14 years for vaccination. And another strategy is our temporary fixed posts, which are the what we call them outreach posts. They'll be going out to the hinterlands, to the hard-to-reach areas, to the security-compromised areas, to schools, to churches, to playgrounds, to motor parks, to everywhere we know we can find these eligible children 9 to 14 years. And like I said before, it is not house-to-house campaign like we did before, going from house to house to put, maybe when we were doing polio campaign, to put 2 drops of polio. This is an injectable. So when our team members enters any community or any church or any school, they will stay in one corner without obstructing the school program or the church program. While the eligible children, the mothers or the caregivers will bring these eligible children to them for them to get immunized. That is the strategy.
Okay. Now, before we open the phone lines for our listener to call in, why are we not vaccinating pregnant women? Mr. Adora, why are pregnant women not vaccinated? Because you talked about them, when they contact, they can transmit to the unborn child.
Okay. So, like we mentioned earlier, pregnant women are one of those who their immune system are low, because of the pregnancy. And this, because of that, we don't want, this is a life attenuated virus. So we don't, from researches, it's not advisable to give it the vaccine to women when they are pregnant. That's why we are covering a whole cohort that can transmit this disease to the pregnant women. By the time we cover 9 months to 14 years. So we're also covering for girls who will get pregnant in the future from this cohort.
Okay.
So that's why we extended, like he's mentioned, during routine immunization, it will only be given at 9 months and at 15 months. But for this campaign, we are covering 9 months to 14 years. We are extending it so that we are in the process protecting our pregnant women too, because these are the age gaps who can easily come down with this measles rubella from researchers, and they're the ones who can give it to the pregnant women. And a virus, once the woman contacts it, it can have effect on the baby. So what we are trying to do is to prevent the woman from even contacting the virus, okay? And by the time we create that herd immunity by vaccinating this age range we've mentioned, the pregnant woman is also protected.
Okay, apart from that, if a child is not vaccinated and the child gets measles, does it go away? With any other treatment, it just go?
Measles, before the vaccination started, measles have killed a lot of our children in the past. And it can come with, there are different grades of symptoms. It can come with the mild symptoms, which he mentioned. But measles can also come with more serious symptoms where you have pneumonia, brain swelling. It can cause inflammation of the brain, that's encephalitis, ear infections, blindness, diarrhea, and even death. Okay? So it's not something you want to play with in children. And, I know some people who want to, take all different kinds of treatment, or just wait and see if it will go, maybe when they start seeing the rashes. But please know that apart from the mild infections, which are those rashes you are seeing, the fever, the cough, the watery eyes, and all those response in the mouth and all that, there are also serious complications that can arise from coming down with measles. So please don't take it lightly. If your child comes down with measles, take that child to the health facility. Make use of this opportunity to protect your children, because we don't even want any child to experience any of these symptoms, because we don't know how severe it can get. So it's an opportunity for us to protect our children for free.
Okay, let me just add to what Cornelia said. Most of the viral disease does not have what we call drugs to cure them. We treat according to symptoms. That is why we say prevention is better than cure. Do you understand?
Okay.
So most of the viral infection, you treat it according to what symptoms.
You manage symptoms.
You manage symptoms till it goes. So that's why it's better that child is immunized and protected from getting that virus.
Okay, before the phone lines begin to buzz, what if my child has taken this measles immunization before now? Can that child take another one?
Yes. Like I said before, I said vaccination does not have overdose. Instead, it increases that child's health immunity and the immunity of the community and environment. Because when a child is given this vaccine and is given another one, he's being protected from different diseases. So all of them will come together to give that child a health immunity.
So whether your child because what we've been giving children prior to now is the measles vaccines, the MCV vaccine. So, but what we are giving now is measles rubella. So measles rubella. So whether a child have taken that measles vaccine, which we've been giving even as part of routine immunization, please, the child will also have to receive this measles rubella vaccine. And after this campaign, the measles rubella will now be part of the routine immunization.
Yes. And again, why the federal government, the Federal Ministry of Health, National Primary Care Development Agency, and NAFDAC and UNICEF and other partners has said we should be giving or have deemed it fit that Nigeria or this country will be given measles rubella because their herd immunity is higher than only the measles. The measles gives you 85% immunity, while the measles rubella gives you 90% immunity. So you can check the two diseases so that yes, this measles rubella, the efficacy is there. And moreover, I want to reiterate, it is free of charge. The government, the Nigerian government, have paid for this vaccine. It is free. It is effective. Okay. So that's what I want to say, because some people might be asking, they will collect money. It's free of charge. Free of charge.
Okay, that's if anyone comes to you and say, give us money for transport or money for refrigerator, please, it is free of charge. Is it also free for you to appreciate them? Yes. Are they allowed to accept the appreciation?
When we appreciate, we don't allow that.
You know, for instance, if they come to my community, the town crier will, gather everybody. Or maybe the traditional ruler may bring them to his palace and appreciate them. Is that allowed?
This is part of this implementation. The town crier is part of this implementation because it's the town crier that the town another will be going around to tell people that these people are here because we have been trained. Because we are not even all of them. We have paid advocacy visit to DAISY. We have went and sensitized them. So they know what they are, even the people calling their people to come out. So we are even going to stay in their palace to deliver these services. If their palace is where well enough, because we will stay in a place that the client flow will be free. And also, when a child is being given this vaccination, that child will wait. We will have a waiting area. The child will wait for monitoring for 15 minutes before that child leaving. Okay. So that is also, we will stay in the, that's why I said it's not house to house. These are injected. So, and it's well planned. Before we do any activity, we do what we call micro planning. The micro planning is knowing how many health workers that's going to do this work, how many town announcers, how are we going to do our mobilization, who is going to do this one, who's going to, how many teams do we need. We'll plan for all those things. How many churches do we have, how many schools do we have, so that we'll check for all these things and put them in place so that when we are implementing, we will not have any hinges.
All right, this is Hot Talk reaching from Spin 95.3 FM. At this point, the phone line is open. You can call us now 0916 0009953, 0916 0009953, or 0805 1777953, 0805 1777953. For WhatsApp, use 0805 5516953. Let's hear from you. Good morning.
Yeah, good morning, Hot Talk.
Good morning to you.
That came from Abba. And good morning to your guest as well.
Yeah, good morning.
Good morning.
Yes, please, I would like you people to get to a village called Inisi Alamba called Amachin Sulu. I would like you to get to that place. Those people are really passing through hell. The health center, you see how their health center is. And I would like you to come and tell the world what you have. One of you said Governor has done well in health. Please go to their health. In
Amachi Sulu. Yeah, I've taken note of it.
You say Amachi Amaje?
Amachi Sulu.
Amachi Sulu. Okay.
Yes, in East Alamba North. Women deliver on pepper. This market women using selling pepper, commodities, food items. That village has never seen light for over 10 years.
All right.
Their road, you push go. Look at their road.
What's your name, please?
My name?
Yes. All right, Nkem. All right, yes. Nkem, we've noted. But just know that these people are from the Primary Healthcare Development Agency. They are not into infrastructure development, but we've noted your point.
However, they can still do something about it.
They've taken note. They'll visit there at least, if not for another thing, to give the vaccination.
Brother, we have taken note of that. I will visit that facility personally. I'll visit that facility myself.
All right. Thank you, Nkem. 0916-0009-953. If you have any question on what we have discussed this morning or suggestions, maybe your village you want them to visit that place, this is time for you to call. I don't know what network is doing. 0916-0009-953 or 0805 1777953. You can as well go to our Facebook page, Pin 95.3 FM, and leave a comment there. Of course, we have some from the social media platform. This one's from Victor U. Carlo. Said, good morning, Honorable Speaker. Okay, call a spade, and a hammer, a hammer. What do you know about measles and rubella? Mr. Speaker, based on discussions, measles, rubella, or German measles are two distinct highly contagious viral infections, while they often present with similar symptoms, namely red. Okay. Okay, he's trying to define and explain them. Hello, good morning.
Good morning, sir.
Good morning to you.
Yeah, I've been a listener to what your program is as regards to the measles and rubella.
All right, thank you.
I want to find out, this measles, has it a limit in terms of age? Like now, I'm a victim since January 2026. I just came for Xmas break. I live in Enugu. So I started having rashes on my body. My wife said it might be water, that change of environment, the water I took. So because of that, I left and went back to Enugu because my Oga treats the water we drink. And I didn't boil my water. And since then, it has been increasing. So at a stage, I went for lab test. They said I'm suffering from malaria and typhoid, which I consulted my consultant, who was in UNTH Enugu. And now I forwarded the picture of my hands to what that has. From the rashes, it became larger and came out. So I forwarded to our family WhatsApp. My cousin is a researcher in London. He now told me that it is monkeypox. I'm still wondering, how do I come about monkeypox at my age, 65 years? So I now forwarded everything, telling the consultant today in UNTH that my cousin said that it is monkeypox. He said, no, it's going to be measles. It's okay, I should wait. He told me to buy some drugs for the itching, because the itching is even on my lips, my ear, my eye, my tongue. Itching, I cannot even have peace of mind. So a letter, the consultants which he met said that it is scabies and they recommended Metizan and some other antibiotics for me to drink. So I drank it, no doubt, it has subsided. But I'm still having that itching. If I scratch starts coming out again. I came back to Umuahia. I met a doctor. He said it is incubated. The drugs I took have not killed those fungi. So that after 21 days, I should repeat that medication again. I called a doctor in Enugu. So that no, I shouldn't for now. Based on the fact that if I should take it, it is going to affect my heart. That Metizan, and I don't know the other name, but it's Metizan. Very tiny. So I should take it 4-4. And I'm asking, at the age of 65, can someone at that age suffer scabies, monkeypox, and measles? Please.
Your name, please.
Thank you very much.
Your name?
My name is Waleki Anthony.
Okay.
All right.
I'm now in Umuahia.
All right.
Thank you very much,
Thank you.
brother. My brother, you will need to go back to the hospital and take proper medication. You need to go sit down with doctor, they will look at you, then you go to lab. They need to scrape some of those things and take it to lab for you to know the proper thing that is happening to you. We cannot stay on the radio now or on the air and tell you what is happening to you. It's only a physician that will tell you how and what that is wrong with you. But in any case, please, my brother, stay safe and make sure you go to hospital and meet with your doctor for him to take proper care of your system.
And just to add, part of his question was if an adult can get measles. So anybody can get measles at any time. Anybody can get measles. And we know with higher the age, the elderly, the immune system is being weakened, because of age. So that anybody can get measles.
Yes. I mentioned anybody that has low immune system, that is malnourished, can get any disease, not only measles. The elderly can also get any disease, and not only measles. You can get rubella, you can get any other viral disease, so long as your immune system is low, or you are exposed to the virus, or you have contact with an infected individual. So what we'll do is, whenever you notice any strange this in your system, go to the nearest health facility around you for a proper check, for a professional to look at it and give you a proper medication.
This vaccination and immunization, they are all preventive. Okay, I want to know, does he have a cure? Let's hear from this caller before you answer that. Good morning.
Good morning, Chukwemeka.
You're welcome.
Good morning, our guest.
Good morning.
Good morning.
Chokode, I want to ask, anybody above 14 years, or will take the vaccine?
Thank you. Anybody that's above 14 years, he or she is not eligible for this vaccine, because government have planned for these eligible people. It's only them that we have planned. Any person above that age will be making another person that is eligible to miss that jab. We are to immunize almost 2 million children in Abia State. 1,970,something children. That's what we are targeting. That is the goal. That's why this campaign is one of the biggest campaigns in Nigeria. In fact, in Africa.
In Africa.
Wow. All right. Now, I asked if it has a cure.
Yes.
For an adult.
The only cure is vaccination.
Vaccination, you prevent it. So, it's a virus. Once you contact a virus, what you do is management. You manage it.
You treat according to symptoms.
That's why you have to report early to the health facility to manage it, to be sure that it doesn't
the symptoms does not increase in your system. Just for example, a HIV patient. You understand? It's management, and you can see that it's reducing the virus. It's reducing across the globe, across Nigeria, because once you manage it, once you get any sickness on time, when your system have not been overwhelmed with virus, so it can be managed, it can be treated. And when you treat with symptoms and the person is being managed very well, you can see that will just phase off and go, because your system will build immunity against it.
Okay, now you said this will commence February 4.
Yes, 4th of February to 13th of February.
So a child who clocked 15 this month is no longer eligible.
Is no longer eligible.
15 what?
15 years.
Is no longer eligible.
This January.
If the child clocks 15 years by 3rd of February, by 4th of February, he or she is no longer eligible for the vaccination.
Because, like he said, the government has made it available for this cohort, that 9 months.
If you make us have a missed children, you might miss child somewhere. Because that one we are giving you is supposed to have given to one of the eligible children within Abia State.
Well, how did you manage to get the data of number of children?
Yes, because we have the total population of Abia State, and this is 42% of the total population of Abia State that we used to bring out these age cohorts.
All right, let's go on a quick break. When we come back, we take more of your calls and more of your questions. The WhatsApp number is still 0805-5516953, 0805-5516953. For phone calls, 0916 0009953, 0916 0009953, or 0805-1777953. We'll be right back after this time out. Stay with us, please.
Spin 95.3 FM. Spin 95.3 FM.
Toby Amazon, look at the clock. I cannot believe it. She's done it again. 2 world records in one night. Lisa again. trying to get round the back of Arneson. He's in, it's Musa, across goal, Musa surely!
Weekdays at 8:30 a.m.
Sports Speed. Now have the freedom to choose.
Records can be broken. Titles will stand the test of time.
Oga, madam, brother, sister, you get business, you dey sell, you dey hustle, but people never sabi you.
Chai, no dey stress yourself. Carry your motor Spin 95.3 FM. Speak out loud. Make them hear.
Now jingles wey go hook ear, radio shows where people dey glue their ear every morning put with correct jingles, branded program sponsorship, promos, shout-outs, news coverage.
We go even carry your business enter Ubani, Simba Show, Motor Park Junction, anywhere people dey.
No dollar, no formal, call us sharply for the number 0703 0803. Or you fit to waka come our office with the for plot 192/193 government station, Ugrube Layout, Umuahia.
Follow us on social media at Spin953FM or check www.spin953fm.com.
Speed 95.3 FM, Umuahia. The freedom to choose.
Accountability, transparency, and inclusive governance. The Governor of Abia State, His Excellency Dr. Alex Oti OFR, will on Thursday, January 29th, 2026, continue his monthly media engagement with journalists through Governor Alex Oti Speaks to Abians. The monthly media parley is a no-holds-barred interactive session that offers the governor the opportunity to highlight key achievements of the administration, clarify government policies and programs, and receive constructive feedback aimed at improving service delivery to the people of Abia State. Date, Thursday, January 29th, 2026. Time, 7 p.m. The venue, Banquet Hall, Government House, Umuahia. The interaction will be broadcast live on the following stations: BCA 88.1 FM, Flow 94.9 FM, Family Love 99.9 FM, Magic 102.9 FM, Vision Africa 104.1 FM, Enyimba 94.3 FM, Real FM 99.1, Sun FM 91.3 Iberi, Sun FM 91.9 Aba, Zik 96.3 FM, Spin 95.3 FM, Rapid 96.5 FM, Peseta 103.5 FM, Buzz 89.7 FM, Masters 105.9 FM, Dawn 103.7 FM, and Skills 87.7 FM. The program will also stream live on major online platforms. Announcer Ferdinand Ekoma, Special Advisor to the Governor on Media and Publicity.
nnọkọ ndị ntorobịa bụ ihe omume anyị wepụtara iji tinye ọnụ n'isiokwu ndị ahụ metụtara ndị na-eto eto ma gosipụtakwa ntụnye oke ndị ntorobịa maka uto na ọganihu ala Igbo, Naịjirịa nakwa ụwa dum gbaa gburugburu. Ihe a mere anyị na-akpọku ndị ntorobịa na-eti ịgba, otu ndị ntorobịa dị iche iche ewere n'ọha obodo, n'ụlọ ụka, n'ụlọ akwụkwọ nakwa n'ebe ndị ọzọ dị iche iche ka ha were oge ihe omume a gosi ụmụ ụwa nke ha jiri biri. Nnọkọ ndị ntorobịa bụ naanị na Spin 95.3 FM Umuahia ka ọ ga na-abịara gị n'ụbọchị Tọzdee niile ma ọ kụọ elekere 11 nke ụtụtụ. Onye nke m, amakwala ama gbajọ ihe omume a maka ọ ga-adị kpọkpọ.
Akụrụ egero mmadụ ọ na-anọ na mmiri nchaba ya anya. Mbanụ ụmụnna, chetakwa na oge agaala mgbe mmadụ na-adabere na simsimsim kọkọkọ n'ihi na ụwa sala anya. Ya mere ịchọ ịmata ihe na-eme n'ụwa niile na Naịjirịa na Abia steeti, soro anyị n'ihe omume anyị okwu gbara ọkpụrụkpụ nke a ga-abịara gị ma ọ kụọ elekere 12 site na Mọnde ruo na Fraịde, naanị na Spin 95.3 Umuahia. Ebe a ka ọ na-agbọtụ.
Ladies, after a long day, where do you unwind?
Right here, of course.
Welcome to Daily Calls, where girls talk freely, honestly, and without judgments. From love to relationships, money and career, to self-care, friendships, and trending gist. We talk it all. Every Wednesday, 7:30 to 8:30 p.m. on Spin 95.3 FM, Umaya. Call in, send your voice notes, share your tweets. Pull a seat, let's talk.
The Girly Couch. Real women, real conversations. Only on Spin 95.3 FM.
Kindly be informed that the opinion of our guests and resource persons are not the opinion of Spin 95.3 FM. Thank you.
All right, welcome back. This is still Hot Talk Spin 95.3 FM. Omar here with Chukwemeka Igu. And of course, my guest in the house, we have Mr. Chukwudi Okpabi from the Primary Healthcare Development Agency, and then Mrs. Adora Eneja from the African Epidemiology Network. Field Epidemiology Network. Okay, and this program is streaming live on our Facebook page and, of course, our YouTube channel. You can go there to watch what we are doing here. Is streaming live as I speak to you. Leave your comments, we'll read them in a few minutes, or send to our WhatsApp line if that is more convenient for you. 0805 5516 953. For calls, 0916000993 or 08051777 Let's pick some comments from our social media platforms. All right, Victor Yukalu said, one, how do vaccines work? Do they work against viruses and bacteria? Two, my child was invited to chicken pox party. My child was invited to a chicken pox party. Would it be better for my child to get the chicken pox this way? Why do we vaccinate against a mild disease like chicken pox? Can you get a disease from the vaccine that's supposed to prevent it? And why do some vaccines have live pathogens but others have killed pathogens? People say vaccines are linked to long-term health problems such as multiple sclerosis, diabetes, and autism. Is that true? I hope you are taking note of all these ones. Yeah. Then he continues, is it true that better hygiene and nutrition were responsible for decrease in death and disease rates rather than vaccine? Why can't we eradicate other diseases as we did with smallpox? Why is allergy to eggs a contradiction to getting some vaccines? Why is it there a new flu vaccine every year? Why do some vaccines require boosters? My speaker, I rest my case.
Yeah, my brother, thank you so much for your concern and question. First of all, vaccine are to prevent diseases. Vaccine are to prevent diseases. Like I said before, it's not curative. That's why we give it before you get that disease. Because when you contact it, it's now treatment. I hope the two things are clear. You get vaccinated for your system to develop immunity against that disease. But when you contact that disease, you will not be treated for that disease, for you to be cured. So these are two different things that we are talking about. And again, I didn't get the last thing he said. He said something concerning.
So he may also mention something about why do you get vaccine when you can maybe build immunity from the disease, I think.
You have to get your system, and if you get the system immunized, and remember, if you don't get immunized, you will not get protected. Once you get contact with that particular virus, you must be infected. You must be infected.
And let's not forget about complications that can arise from getting infected.
Yes.
You know, it's easy to say, oh, okay, don't worry. When my child comes down with this, you build immunity.
Yes.
What of the complications that can arise, that can even lead to the death of that child? That is why the vaccines are there to protect you, to prevent your child from coming down with that disease.
Okay. He wrote so many things here. Is it true that better hygiene and nutrition were responsible for decrease in...
Remember when I was talking, I said personal hygiene is a key. But when you are doing personal hygiene and you get in contact with the virus and you are not protected, you will get infected. It's as simple as that. So as you are protecting yourself, increasing your personal hygiene, you need to protect your system by getting immunized. And remember, all this, if you look around now, you hardly see people going on wheels in our main roads. This is the work of vaccination. It's the work of polio. Like he talked about smallpox. Smallpox are being eradicated. It's the work of vaccination. It's not the work of personal hygiene or getting a new system. No, it is work of vaccination, getting vaccinated. Do you understand?
Okay.
So that is why we want to get this virus, this rubella virus and measles virus, out of our environment. And that is why the government have increased the age bracket. So that when this, because when this 9 to 14 years are the more reservoir of these viruses. So when they are being protected, the pregnant woman and other people, the elderly, even the person that has the weak immune system, will not even see the virus to get infected.
Okay, there's another thing that people say vaccines are linked to long-term health problems such as multiple sclerosis, diabetes, and autism. Is it true?
Just the normal rumors, misconceptions people talk, and we have been facing it all this while. And that is why we are here, to educate our people, to tell them the right thing. It is when you know that you can be able to. You said, don't say they said. Who said? Where is the source of that theory you are propagating? Who said it? Where is the website? Who are the person that? But you just said some people, they said. So that is why we are here, to provide you the right information, to provide you the benefits, and even tell you the signs and symptoms of everything, so that you can know the right thing to do and get the right information, so that you yourself can be an advocate toward this vaccination.
Okay, and
and don't forget that researches have been done. The data is there to show that these vaccines are safe. Okay, a lot of us took vaccines as kids, and this vaccine, this particular measles rubella vaccine we're talking about, has been in existence for a long time. So the researches have been done to find this safe. If there were long-term consequences, it would have been discovered by now. So there's no need to panic about or worry about vaccination. It's completely safe.
All right, Blessing Wikabara said strategies and awareness are some of the fundamentals for effective elimination of measles and the rubella in our society. But I must add that funding is also essential to push this drive. It's obvious that these diseases are dominant in the rural areas. So effective strategies are reaching everyone in the rural and urban areas during the vaccination process and even beyond. With serious awareness campaign, of course, prevention treatment will go a long way in reducing the outbreak. Okay, thank you for that recommendation. I think we discussed that. Blessing Wokiabara. All right, let's harvest other thoughts from the live streams. This one said, how do vaccines work? I think we've talked about that. Let's speak from... Hello, good morning.
Good morning, my dear Chukwemeka.
Good morning to you.
It's Mr. Chijoke. Yes, I want to commend your guest. And I want to say that whatever thing they are saying, I think we should take it serious. Because this issue of vaccine, I have met a lot of people who make me to understand that it's because of a lack of vaccine that make them to be a grateful people today. So many people have issue of a kind of anxiety, because during their time as a child, as a kid, their family members refused to take them to vaccinate them, all those things. So we should take it serious. The point I am making is this: don't say, let them keep on talking. Because tomorrow, something may happen. And it's a kind of outcome of not taking all those vaccines. Let us take this in serious. Because even the government is paying a huge amount to make sure that we are secured. So let us look what is happening in the north and use it as example to ourselves. Thank you.
All right, thank you, Mr. Chijoke. Thank you. 09160009953 or 080517779553. And Honorable Elvis Ihweze Maximo said, watching and texting from the city of Umuahia, Abia State Capital. Good morning, gentlemen in the studio. Keep up the good and amazing work. All right, thank you.
Thank you very much.
Thank you very much.
Okay, it is streaming live on online platforms, Facebook, YouTube. You can go there. You will see what we are doing here live. And of course, send your thoughts quickly. Time is no longer on us, so I really have to go. Okay. At this point, Mr. Chukwudi, your parting words quickly. Our time is fast spent.
So much. My parting word today is, please, mothers, parents, caregivers, give consent to your children. The ones that are in school, that are in boarding school, that are not with you, give consent to their school for them to be vaccinated. And also, bring out your children 9 months to 14 years on the 4th of February to 13th for this vaccination. We will be in the schools, in churches, in playgrounds, in your place, but it is not house to house. You have to bring out these eligible children for our team members to get them immunized.
All right, Mr. Dora.
Okay, thank you, everybody. And it's just to remind us that we owe our children that protection. It's one of the things we can do for our children to protect them from diseases, and this is an opportunity to protect our children from 9 months to 14 years. Please, let's bring out our children, consent, and this from that 4th February to 13th February, we have the opportunity to protect our children. Thank you.
All right, thank you very much, everyone, for investing your time with us. It's been wonderful having you around. I am Chukwemeka Igu. Thank you for that. And tomorrow, Friday, we'll be right here for another interesting package. Do have yourself